If you have HPV and you get a hysterectomy, you're at a significantly increased risk of developing vaginal dysplasia. The reason I'm doing this video is that some women reach out to me and they're contemplating doing a hysterectomy just to be done with HPV and cervical dysplasia. So they're disgusted. A hysterectomy may have not been recommended, but they're thinking hysterectomy because then they won't have a cervix and they can't get cervical cancer and everything will be fine. The problem with that thinking is that if you get a hysterectomy and you have HPV, it's going to increase the risk of developing vaginal dysplasia. Now, it's even worse if you have SIN3 or maybe cervical cancer and you get a hysterectomy. The likelihood of developing vaginal dysplasia is about 8 times higher than for women who do not have severe dysplasia and HPV. So what are my recommendations? If you have to get a hysterectomy, and sometimes that's the case, then you may want to identify whether you have HPV prior to doing the hysterectomy. Now you may think, well, I get regular PAPs and they must be testing HPV and they haven't said anything, therefore I don't have HPV. Don't be so certain about that. A lot of doctors don't do HPV tests. Some do reflex testing, which means they'll do a PAP, and if the PAP is normal, there's no HPV test. If the PAP is abnormal, well, then they'll reflexively run an HPV test and identify whether you have HPV. So you'd really like to know whether you have HPV prior to doing the hysterectomy, because the guidelines on what you should do after hysterectomy are different whether you have HPV before the hysterectomy or you do not have HPV before the hysterectomy. If you have HPV and you do a hysterectomy, you need to continue screening regularly post-hysterectomy because you want to identify whether you're starting to develop a problem. And generally with all HPV conditions, the sooner you know that you're developing dysplasia, the more that you can do about it, the more options you have, and the better the options. If you start developing severe vaginal dysplasia, they'll start doing laser treatment, even sometimes partial vaginectomy. I've had patients who've had partial vaginectomies because they develop severe vaginal dysplasia. And it affects your quality of life. When you start getting vaginal dysplasia, it's frustrating. It's probably a little bit less responsive and more likely to come back than cervical dysplasia. And it affects your quality of life. You may not be able to have sex. You may not be able to have comfortable sex. It can really put a drain on you. So in addition to continuing to do yearly PAPs and HPV tests after hysterectomy, this is for women that have HPV before the hysterectomy, you need to continue doing annual PAPs and HPV tests. And I would also suggest that you want to do everything you possibly can to deal with it. Okay, what that means is maybe diet, maybe some supplements, maybe vaginal suppositories. You want to be doing everything you can to maximize the likelihood that you clear the HPV. And this is after doing the hysterectomy. Now, the good news is that if you have HPV and you get a hysterectomy, about 80% of women will end up clearing the HPV in about a year. But if you don't end up clearing the HPV, you need to continue working at it and prevent vaginal dysplasia from occurring in the first place. So I hope this video was helpful. Please like, share, and I will see you next time.